here we are, again, Sandra McGrew. I'm the communications director here at ACHI. So this panel is with seasoned journalists, and oh, how the tables have turned. Now we get to ask you the questions. So our discussion today, we're going to highlight current issues in health and healthcare for our state, and we're going to talk about media literacy and also how misinformation and disinformation have played a role in some of your reporting. Let me do just quick introduction. So here on the end, we have Roby, host and executive producer of Talk Business and Politics and host of Capitol View, which airs on KARK Sunday mornings. We have Gwen Moritz, former longtime editor of Arkansas Business and current contributor to various Arkansas Business Publishing Group publications. We have Tess Vrbin here. She is with the Arkansas Advocate, which is a nonprofit, policy-focused digital news outlet. And then, of course, Andrew DeMillo. He is the Capitol correspondent for the Little Rock Bureau of the Associated Press. So thank you guys so much for being here. Okay, so first question. We consistently rank at the bottom for healthcare rankings, unfortunately. Based on your observations and reporting, what are some common threats that contribute to these low rankings? Roby, let's start with you.
Okay, I'll go first. How about that? Well, thanks for having us here today, and I also want to say happy 25th anniversary, birthday. I'm not sure what you do, Joe, but that's congratulations. 25 years is a big thing. I know that because Talk Business is 24 years old, so next year will be 25 for me. So did you shameless plug there? Do you see how I did that? That's good. So your question is, why do we consistently rank low, or why do we not move the needle? Or
right. What have you seen based on your many years, as you just stated, of reporting on these?
I'm glad that you got all the history in there of what's happened in the last 25 years. I was going to kind of go through a laundry list of some of that because I've been witness to all of that. And I actually go back 31 years this December to my first state political job, which was working for Governor Jim Guy Tucker when he passed the soft drink tax, which Ray Hanley will remember very well, and a lot of people in this room will. We had a Medicaid crisis at the time, and he didn't even wait till January when the regular session started. He started in December of '92 after Bill Clinton finally vacated the governor's office and made him governor. I think one of the reasons we're constantly addressing healthcare at the state level is it's rarely the linchpin of a gubernatorial campaign. They always focus on jobs, they focus on education. They'll talk about healthcare, but it's rarely like the platform that they run on. It doesn't happen often. It happens a lot at the federal level. Your congressional candidates, your Senate candidates talk about healthcare a lot, but I don't typically see a governor make healthcare a cornerstone of their campaign. And I think some of that is because if you look back at some of these major events that happened in healthcare over the last 25, 30 years, most of them are a response to something that's happened at the federal level, like the Affordable Care Act, or it's a crisis situation, COVID-19, for example. So a couple of these things like the smoking ban, the tobacco tax for trauma centers, those were definitely things that were plotted out and planned for, but there were other still bigger priorities. So I think the fact that in state government you don't see governors centering on healthcare as the primary reason they're running for office is one of the reasons we don't see more attention given to that. Not that they neglect it, but it's just not their number one issue. And number two, the turnover in the legislature is the other thing that I just think contributes to, there's just not a consistency there for a large group of the membership of the General Assembly. There are experts in those fields, and there are some that become experts in those fields, but because you don't have that consistency, because of the turnover at the legislature, and eventually a turnover in the governor's office too leads to different priorities. I think that we haven't always had a consistent, clear idea of where we want to move the needle in healthcare as we respond to crises or things that happen at the federal level. It's just kind of my general observation.
Gwen?
I'm not sure that I took the question. Am I on? Took the question the same way he did. I was thinking more on the individual level, which is why do we as a people rank so low? And I think that is, it's just poverty. Education and poverty, they're also closely aligned that way. And as long as Arkansas, I think ACHI and so many of these programs have attempted to address the result of that, but we just keep having a lot of poor people here. So as long as you have more poverty, you're going to have more health problems. You're going to have, and especially and this is not unique to Arkansas. This is the American way, is to have so separated health care from government. We're talking about things our government has done, but in most of the developed world, you all know this, healthcare is a priority, is one of the jobs of government, and here government kind of fills in. Our government tries to do backfill on healthcare rather than to provide healthcare, and I think in the states where there's a lot more money and a lot more people with more education, they have less backfilling to do. But in Arkansas and other states, not just Arkansas, that separation, that healthcare as a private sector service is where you have to do, is the reason we have so much variation from state to state on that.
Tess, what are your thoughts?
Well, I've only been in Arkansas for about 2.5 years, so I don't have quite as much experience and knowledge base as y'all do. But what I've observed in the past 2.5 years is that sometimes there seems to be a little bit of a disconnect between officials, whether they're elected or appointed as the heads of state agencies, disconnect between officials and basically the common man. And that kind of leads to Gwen's point about backfilling and being more reactive than proactive. And a couple of examples that I've followed closely over the past couple of years. Recently, you probably heard a lot about the Medicaid unwinding, where DHS spent 6 months assessing the eligibility of Arkansas Medicaid recipients, especially those who had their coverage extended for 3 years during the pandemic. So if their eligibility changed, they just got to stay on whatever coverage they had. And every state has to now unwind that extension, make sure that people are eligible. And Arkansas took 6 months to do that. Every other state gave itself more time to get that done. And also to Gwen's point about poverty, before the unwinding this year, which started in April, there were about 1 million people on Medicaid here in Arkansas, and that's about 1/3 of the population for context. There's a good bit fewer now, fewer than 900,000 for sure. Can't remember the exact number off the top of my head, but in a sparsely populated state, that is kind of a significant drop. And a good chunk of those people who got disenrolled were disenrolled just because DHS hadn't confirmed their eligibility. Maybe they didn't turn in paperwork or follow up on paperwork, which has really ticked off a bunch of people, whether that's state officials or grassroots organizing groups, because there were some advocates who were very, throughout the unwinding process, they were having press conferences and protests and saying, we're trying to get through to DHS and get them to make sure they're confirming eligibility and kind of bolster their system of doing so. And they felt unheard and frustrated. They wanted to, there was a law from 2 years ago that required the 6-month process. So that was kind of set in stone, but But that was a situation where you had a lot of folks who don't have a lot of money and power, who were trying to reach out to those who are in positions of power to try to make their own lives better, and they felt like they weren't being listened to.
And also just being such a rural state too, and so, so vast has been obviously a big challenge too. Andrew, what are your thoughts? Let's close this out on this question.
I think basically it is my
I think so. Is it? Oh.
You got to help these AP people.
I'm a print guy. Come on. I think mainly, the only thing I really add to that is, poverty is such a big part of it. The healthcare system is so difficult to navigate anyways, for everyone. But being such an impoverished state, I think really exacerbates that problem. And that's a theme that we've seen in so many stories. I think the disenrollments is a good example of that.
Absolutely. This is going by so fast. Okay, so let me hit on a couple of other quick questions here. We know that media plays a big role in responding to health issues. Talk to us, first of all, can someone explain to us what media literacy is? And then let's talk about why it is important and how this ties into misinformation and disinformation as you're reporting stories. Let me start with you, Andrew.
And I think this is really important. I think media literacy is the best example I can use from our perspective from covering things is the old way of covering legislative hearings was the two quotes and a vote. You have a quote from one side, you have a quote from the other side. Whatever the vote was, that's it. You guys figure it all out. With so many complicated topics, especially in healthcare, that is a very irresponsible way of covering things. And I think you've seen news organizations moving away from that and really doing fact checking, not just as separate from the spot story, but as the spot story itself. Making sure that you're not giving one side free rein to say things that are completely false. I think COVID is an example where that was really important. And AP has put a lot of resources into doing accountability journalism and into health reporting, and to make sure that the public understands, but also the reporters covering it understand it as well.
And the fact checking piece of it too. And that is such a challenge because we know, as y'all all know, right now we're seeing, just newsrooms are consolidating, ownership groups, and reporters are having to do a lot more with less. So we know that's a challenge. Gwen, let me go to you next. What are your thoughts?
Well, our, is this on? Our audience in Arkansas business is so different from a general audience or for a television audience. It's just, we're writing for on a different level about different things. We're not generally the ones that are going to be telling Arkansas business readers about that they need to get a vaccination or something like that. We're going to be doing much more data heavy kind of reporting on that. So I don't really feel like media literacy is a problem with my audience, but Lord, I see it everywhere else. And I wish I knew the answer. We would all be in a different place if the answer to people getting their messages from people they trust, who got it from someone they trust, who got it from someone they trust, who doesn't have any idea what the original source on it was. I mean, the viral news, I think, may kill us all.
I just to chime in on that too, I'll give you a great illustration. My father, who has passed away, so I can tell stories about him without any worry about repercussions now. College educated, CPA, super smart guy, successful businessman. I remember when the Affordable Care Act was being debated for months at the congressional level. I was at his house one day for something, signing some documents or getting something taken care of. And he had been watching Fox News that morning. And he said, "Can you believe that this Obamacare is going to force mandatory parenting?" And I was like, what? I didn't even know where this was coming from, left field. And I'm like, mandatory parenting. This is in the Affordable Care Act. And he said, they've been talking about it all morning on TV. And I was like, okay, what are they saying? So we have about a 45-minute conversation. It's right there on page 643. They're saying it's on there. I said, get your computer out. Let's pull up page 643 in the Affordable Care Act, draft. And we find it. And it's something about insurance companies would be given permission to offer policies that would allow for parenting classes to control anger management, to learn how to properly provide nutrition to your children. It was totally permissive. And so we read it and we go through this. This is a 45-minute exercise, again, with a college-educated grown man who's pretty smart about a lot of things. And I said, would you agree that this is not mandatory parenting classes? And he said, yeah, but there's a bunch of other stuff in that bill that's just terrible. And I was like, oh my God, I don't have an hour every time that you bring up something like for one person, but that's how on the ground it has to be to dispel the misinformation that can get out there quickly. And this was 2009. This was a long time ago.
And the amplifiers for misinformation, there's just so much more with social media, the 24-hour news cycle, that's been a huge challenge. I'm going to ask one more question, but before I do, I just want to draw everyone to the screen. If you would like to submit a question for this panel, please do so. You just go to this QR code and it'll bring up a form and you can just type in your thing. I'm watching, I can see here what. Let me ask this, in the last couple of years, and Tess, I know you've been here for about 2.5 years, what is a story that you have reported on that has surprised you the most?
I can think of several non-healthcare related stories that have been a surprise to.
We'll come back to you. Gwen.
I have an answer for this. I should not be surprised, but I'll never cease to be surprised by Medicare and Medicaid fraud stories, the size of them, and that politicians talk so much about waste, fraud, and abuse, but hardly ever mention that it is the providers that are almost always the ones that are ripping off the system. And it's just every few months we'll have another one, and it's $15 million or it's $80 million. And that I never cease to be surprised by those.
I did think of one. I got hired at The Advocate right when Roe v. Wade got overturned last year, and so I told my editors I would really like to cover the fallout of this in Arkansas, because I knew there was a trigger law in place and things like that. And so I started looking at this grant. The state has been distributing state funds to crisis pregnancy centers. They're starting to call themselves pregnancy resource centers now, and they're changing the language they use to describe themselves, but these are usually religiously affiliated centers that discourage abortion, which is all but illegal here, but still they had said, some of them had said publicly, they hoped they'd get more traffic with the trigger ban in place. And so I records requested the applications for this grant money, and it's a $1 million grant fund. They've renewed it. They're probably about to, I keep checking to see if applications are open this year, and last I checked they weren't, but I'll keep checking. And I records requested the applications last year. It was August of last year, and several of them said that they wanted to use this funding to enter contracts with Google and put targeted ads in front of people that might have an unplanned pregnancy and might be seeking an abortion, even though you can almost never get an abortion in this state. But still, I just thought that was really interesting. Several of these centers wanted to do data mining, basically, and use state funds, like taxpayer funds, for that. And so So I wrote a story about that, and it got a lot of traffic, and it was something that that
generated
was
a lot of response from your
it did.
readership.
Yeah, I was kind of surprised to stumble across the story to begin with,
Right.
and then to get as many eyes on it.
Yeah. All right, we have about a minute and a half left. Andrew, anything that you reported on that generated a lot of interest that you were surprised by?
Something that I've been focusing on a lot this past year is I'm part of a national team of reporters covering LGBTQ plus issues and legislation affecting that community. And it's been really helpful. The stories that I've covered where I've been able to talk with families, families of youth who have received gender affirming care, providers of that care, and really kind of understanding its, the personal stories about it is a lot more. It's affected me in terms of understanding this more than sitting through legislative hearings, sitting through debates on it would be. And so being able to hear those personal stories has been maybe not surprising, but incredibly helpful.
Okay. Roby?
Well, I'll go back to the Affordable Care Act again. I think this hits the nail on the head of the challenge that's out there for the media to educate the public and for you as folks in the ecosystem to help educate the clients that you serve and the people that you work with. I remember a town hall that Senator Blanche Lincoln held, I think over at Children's Hospital in 2009, maybe early 2010, I can't remember the time period, on the Affordable Care Act. Vic Snyder was there and maybe Mark Pryor, can't remember who else. And this lady stood up and told, she was an older lady, and she told Blanche Lincoln, "I want you to keep the government out of my health care." And Blanche asked her, "Ma'am, are you on Medicare?" And she said, "Yes, and I don't want the government to mess with it." And I thought, we got a really big problem here with communication. That mentality is out there about people's understanding of how the healthcare system works. It's complicated. It's not easy. So when you're disenrolling people from Medicaid, people don't understand where they're supposed to go for answers as hard as DHS tries. I think we eliminated the ability to have navigators by law in that thing that accelerated it by 6 months. So I just think we've got to find a way to do more to help people become more literate about how the healthcare system works. And I don't know if I had the answer to that, I wouldn't be sitting on this stage because I would have already franchised that concept and idea, and I'd be shooting you guys a video telling you all happy anniversary. But it's a very complicated problem to try to solve, but I think that's at the root of it, is people don't understand how it works.
And it's the communication, of course, which goes back to the misinformation and where people do get their information, and that puts it on you guys to ensure that you're telling complete stories. Difficult because the healthcare system is complex, like we've all just said. Okay, I think that wraps us up. I feel like that went by so fast. Thank you so much for being here and sharing your perspectives with us. We really appreciate it.
You're welcome.